Hi, my name is James John O'Donnell, and I'm going to be giving you a quick overview of urine drug screens. So, the first step in determining whether someone has a drug in their system is often the urine drug screens. So, drug screens may be performed to test for drug use after a crash, to assess for liability in a case of a workplace accident or a workman's compensation case, to test for drug use in prospective employees, or as part of a compliance for a drug program, and many other criminal and civil situations. So the drugs that are typically tested by these urine drug screens include cocaine, methamphetamine, morphine, marijuana, and phencyclidine. And sometimes an expanded panel is used which also tests for benzodiazepines and phenothiazines. So urine drug screens test whether certain drug classes are present, but they cannot distinguish between individual drugs. So for this reason, a test for morphine will also be positive if the person is on any opioid medication. So what are the advantages of urine drug screens? So they're very cheap, they're fast, and they're non-invasive. Don't involve any syringes. So urine drug screens are based on immunoassay technology, which means that there's an antibody which binds to a particular part of the drug molecule. And what this triggers, this binding triggers the release and detection, or the change in the release and detection of a certain wavelength of light. So in more simplified terms, the more drug that's available to bind this antibody, the more the assay signal changes. However, because this antibody is targeting a specific part of the molecule, any drug or molecule which contains this chemical structure will also be bound by the antibody and therefore will give a positive result. So therefore, this leads to cross-reactivity and false positives. For this reason, any test which will result in legal consequences or which will impact the individual greatly, such as, for instance, the loss of a job, should be also confirmed by a GCMS test. So the urine drug screen is not sufficient. This is because basically this GCMS test is much more reliable in determining whether an individual drug is present as opposed to just a drug class. In addition, there's another way which we try to reduce these false positives, and that way is to raise the cutoff concentrations. So in the late 80s, early 90s, poppy seeds people would eat bagels with poppy seeds and they'd test positive for morphine. So as a result, the cutoff concentration to trigger a positive test was raised. And in general, they try to make the cutoff concentrations for positive tests to be higher than the limit of detection. However, this doesn't rule out that there's other situations in which sources of cross-reactivity are combined, which still may trigger a positive test. So let me give you an example. So let's assume someone had some poppy seeds, and also was on Tylenol with codeine. So individually, these may not trigger the positive tests with the specific doses amount which were given. However, in combination, they may add up to trigger a positive test. So that's also something you need to look for. So when I'm evaluating cases involving a urine drug screen or any sort of drug tests, I try to go back to the lab, obtain all the lab reports, and go through the analysis myself from scratch. So I'll go back to look at the spectra and make sure all the drug assignments were done correctly, and make sure all the proper protocols were followed. Secondly, I will not only check that the analysis was done correctly, but I'll check that the instrument should give accurate results. And there's something called method validation. And method validation is basically a battery of tests that you submit an instrument to make sure it will give accurate results. And a second aspect of method validation is to make sure that the people who are conducting the drug tests and who are analyzing the results have adequate credentials. So basically all these things I test for, and as a chemist I have personal experience with both immunoassays and GCMS, which are used for the urine drug tests and confirmatory tests respectively. So I'm able to go back and do all these things from scratch. So one big case I was involved in for which urine drug screens were, it's very important to have a deep understanding of urine drug screens, was a case in which a patient was potentially given an opiate by mistake and died as a result. Now the hospital insisted that she was never given an opiate. She had no prescription for opiates. However, there was several different things which indicated that she wasn't on an opiate. First, she had respiratory depression, which is characteristic of opiates. Of course, someone who's sick may have respiratory depression on their own for some reason. But however, she responded to an opioid antagonist called Narcan. So responding to Narcan is indicative that the person was on the opiate. So that's a piece of evidence number 2. And finally, and what is relevant to this talk, was the urine drug screen. So she tested positive for opiates. So morphine was positive. However, the wrinkle in this case was that she was also on an antibiotic called Levaquin, which is known to cross-react with this assay. So the hospital insisted, well, she was on Levaquin, therefore it was a false positive. However, I went back and I looked at the amount of Levaquin she was on and when she took it, and followed the pharmacokinetics to predict what the drug levels of Levaquin would be at the time of the urine drug screen. And what I found was that the levels would not be sufficient to trigger a positive test. So there's a cutoff concentration for which that would trigger a positive test. So it's not enough just to look at a list and see whether someone was on a drug and say, okay, it was false positive. You also have to look at how much of the drug was given and when it was given, and follow the kinetics. So basically, in conclusion, I was able to conclude that the person was likely on the opiates, and therefore her death was likely due to this opioid injury. So that's a quick overview of urine drug screens, and hopefully you can see why a deep understanding of urine drug screens would be important in many drug cases.